Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. When a toothache strikes, it numbs the body. It can feel like a tiny tooth has declared war on your entire body. But modern dentistry provides for a procedure that saves teeth from the brink of extraction, that is, the root canal treatment. Often feared, sometimes misunderstood, and yet always a savior, a root canal treatment is a rescue mission that brings your tooth back to life. Today in Wellness Watch, we discuss root canal treatment. I'm Preeti Kaur. Root canal treatment, RCT for short, sounds scary, right? But it is actually a common fix to save an infected tooth from extraction, easing pain and preserving your natural smile. What to expect during and after, common myths busted and tips for a smooth recovery. Sujata Locher brings it down in this package. Let's take a look.
You're enjoying your favorite meal when a nagging ache in your tooth refuses to fade. That persistent pain is your body's warning, and a root canal could be the solution you didn't know you needed. So what is RCT? Root canal treatment is a dental procedure to save a tooth that's infected or badly decayed. Inside every tooth is a soft area called the pulp. Decay, injury, or deep cavities can lead to infection. The dentist removes the infected pulp, carefully cleans and disinfects the inside and fills it up so the tooth stays alive and functional. Now, types of RCT. The classic one is conventional RCT, done manually using files to scrape out the infected material. It's precise but can take multiple visits, especially if the canals twist and turn, which they often do in molars. Then there's rotary RCT, using powered nickel titanium instruments that spin and shape the canals faster and smoother. This cuts down treatment time and reduces the risk of missing tiny branches. For tougher cases like hidden fractures or retreated canals, microscopic RCT uses a surgical microscope for 25 times magnification. For children, a related procedure called pulpectomy removes the infected pulp from baby teeth to keep them until they fall out naturally. The procedure, under local anesthesia, dentists drill into the crown, remove the pulp, clean the canals with disinfectants and fill them with gutta percha, a rubbery material, then cap the tooth with a crown for strength. It takes about 30 to 90 minutes per session. Success rate? Over 90%, and the tooth can last a lifetime if cared for. Side effects are usually mild and temporary. After treatment, some tenderness or pain is normal for a few days. You might notice the tooth feels different when biting. Swelling can happen but is uncommon. If the infection was severe and lasted long, occasional lingering discomfort is possible but usually fades. Teeth treated with RCT can darken over time. So, dentists often recommend crowns to strengthen and protect them. In rare cases, infection returns because bacteria were missed, which may require retreatment. Allergic reactions are very uncommon with modern materials. In India, RCT hits close to home. With our love for sweets and spicy street food, decay strikes early. Over 80% of adults have some tooth damage by 35. Urban clinics in Mumbai or Delhi offer rotary and single-visit options affordably, around 3,000 to 8,000 rupees per tooth, covered partly by insurance now. Ayurvedic remedies like clove oil help short-term pain, but they don't cure deep infections. Modern RCT does. Government schemes like Ayushman Bharat are pushing more dental coverage, making it reachable. Prevention? Brush thoroughly twice a day. Floss regularly. Cut down on sugary foods and drinks. Rinse your mouth after meals. Don't delay dental checkups, even if your teeth seem fine. Watch out for sensitivity to hot or cold or odd aches. Those early signs can help avoid bigger problems. Root canal treatment isn't just about technical fixes. It's about giving people back their confidence to eat, speak, and smile without pain. Trust the good science, the right dentist, and routines that keep problems at bay. Sujata Lochab, Wellness Watch, DD India.
Alright, so root canal treatment is to repair and save a badly damaged or infected tooth instead of removing it. The term root canal comes from cleaning out the canals inside the tooth's root. Earlier, root canal treatments were very painful. With dental advances and local anesthetics, little or no pain is felt during the root canal treatment. In fact, it is probably more painful living with a decayed tooth. Options other than a root canal include removing the damaged tooth with no more treatment, or removing and replacing the tooth with a dental implant, bridge, or removable partial denture. Today in Wellness Watch, we find answers to these questions. What is a root canal treatment? When is this treatment needed? Does the treated tooth last long? What care is needed after the treatment? And we also take a look at medical advancements in India. Alright, India is known for accessible and affordable dental care. Root canal treatment in India has advanced with nickel titanium, rotary instruments, cone beam, computed tomography and imaging microscopes for enhanced visualization, and improved irrigation and sealing materials that make the procedure more precise, efficient and less invasive. Up on your screens, we have the hospitals and institutes that particularly cater to this. All India Institute of Medical Sciences, Delhi; Maulana Azad Institute of Dental Sciences, Delhi; Government Dental College, Bangalore; Civil Hospital, Ahmedabad. To help us understand this treatment better, we're joined in by guests in the studio. We're joined in by Dr. Seema Yadav, Professor, Conservative Dentistry, MAMC. And we're also joined in by Dr. Vijay Kumar, Additional Professor, Center for Dental Education and Research, AIMS. Thank you both of you for joining us this afternoon on Wellness Watch. Dr. Yadav, to begin with, you've shown a detailed report to our viewers as to what is a root canal treatment. Help us understand, when is this treatment needed and what is, in a nutshell, a root canal treatment?
And what is not seen, which is embedded in the root, in the bone, is root. The tooth gets its nourishment from the canal inside the root, which comes through the canal. So the blood vessels and the nerve nourishes the tooth structure, and it gives strength to the tooth structure. So when the pulp gets infected, that's before speaking to the root canal, I also emphasize on the layers of crown. The first layer is enamel, the second layer is dentine, and the central portion is occupied by pulp. When the pulp gets infected, you need a root canal treatment, because the infected pulp can cause pain, swelling and discomfort to the patient. So when the pulp gets necrotic, or when there is a trauma, the pulp gets infected after an accident, the tooth gets fractured, then in that case you require a root canal treatment.
Alright, Dr. Kumar, can a root canal treatment ever fail?
Yeah, so root canal treatment is a procedure which is done by dentists to treat the infection inside the roots. So it is a routine procedure for a dentist, and it enjoys very high success rate. But yes, definitely it does not have a 100% success rate, but almost 90 to 95% of the cases it is successful. But there are certain instances, if there are certain resistant bacteria which the dentist is unable to clean, there are certain intricacies of the root canal system. If the tooth is curved, very long roots which are difficult to manage, in those situations sometimes the root canal can fail, but generally it is a very successful procedure.
Generally it's a successful procedure. Dr. Yadav, is it always better to completely extract the decayed tooth instead of opting for a root canal treatment?
See, the extraction will be very expensive. Root canal is cost-effective treatment, and it is more successful. The outcome of root canal treatment is the survival rate is more with root canal, and you can say it's an artificial implant, the natural implant. The implant or the partial denture or the bridges requires a lot of expensive materials, as well as it requires a lot of time. So root canal preserves it saves the time, as well as it's a cost effective treatment.
Dr. Kumar, when is it the time to get a root canal treatment done? Because these days over the table, medical options are easily available. Gels are available, that painkillers are available. So put all this together, when a person experiences pain, does that mean that there is the need to immediately get a root canal treatment done? Or added to that, do we also have home remedies that can help in toothache? To what extent do these help?
Yes. So, the toothache can be of various types. One can have sensitivity that can also perceived as pain, and one can have a real pain which gives them sleepless nights. So, depending on the intensity of the pain, the treatment varies. Not all sensitivity or pain requires root canal treatment. We can manage it with desensitizing agents if it is because of the wear of the tooth. But yes, if it is a tooth decay which has reached to the nerve of the tooth, then definitely a root canal treatment is required, and there is no home remedy which can be an alternative. It can give you relief for some time till the time you reach your dentist, but definitely a root canal treatment is something which needs to be done. So, when do you need a root canal treatment? Suppose you are eating something and there is a severe sensitivity and it persists for a long duration. If you eat or drink something hot and cold and it subsides, then definitely visit a dentist and they can manage it with a filling also. But if your pain is persistent, it is long, maybe after it is persisting 2 to 3 minutes after the eating or drinking hot and cold thing. If you have a pain at night, if it is radiating and it suddenly disturb your sleeps, and if you have a pain which is radiating to your head and forehead, then in these situations, if there is a decay in the tooth, definitely a root canal treatment is required.
So you rule out home remedies altogether, but then doctor, yes.
Yes, home remedies just for instant relief till the time you reach a dentist. Over the counter medication just to get relief till the time you reach dentist. But definitely a root canal treatment is something which has no alternative.
It has no alternative. Dr. Yadav, is there any particular age group when we talk of root canal treatment that is more prone to tooth decays? And added to that, do children also get root canal treatment done?
See, the majority of population which comes, the research has shown that 31 to 40 years of age are more prone to root canal treatment. Why? Because in this age group, the vascularity of the tissue is more, the canals are wider. As the age advances, the canals gets deposited by hard tissue and the canals gets narrower, and sometimes the canals gets blocked also. So, with age the infection chances are less, and with younger age group the chances of infection because of decay or fracture, the infection is more prone. So, the age range, mostly the majority of the population who requires root canal treatment comes in the range of 31 to 40. And 55% of the population which is more than 18 years of age has had one root canal in their oral cavity.
I also asked you about the possibility of children having root canal
Yes,
treatment.
the children also get because the pulp anatomy is different from the permanent teeth. The primary teeth have a different anatomy. The permanent teeth have a different anatomy. The primary teeth are more prone to infection because the pulp is closely located near the enamel. So, when the decay starts, the decay progresses very faster in primary teeth. But the materials for permanent teeth and for primary teeth differs. You cannot have the same materials which you use to seal root canals in permanent teeth is not the same for primary teeth. Primary teeth, because they are age limited, they resorb by permanent teeth comes by the age of 12 years. So, for primary teeth treatment, the obturation or the sealing is done by a resorbable material, so that it gets resorbed as the permanent tooth erupts in the oral cavity.
Does this root canal treatment somewhere also affect the permanent teeth of the child?
No, it instead it prevents infection of the permanent teeth. Otherwise, there are chances that these infections may affect the development of the permanent teeth. So, root canal treatment in children is beneficial rather than harmful to the permanent teeth.
All right, Dr. Kumar, help us understand what kind of treatment is required after one gets a root canal, what kind of care is required after one gets the root canal treatment done?
Yeah. So, root canal treatment is a treatment which we done to preserve the tooth structure. So, the care of the tooth which is a root canal treated is as good as you are maintaining the oral hygiene of your healthy tooth. In spite of that, the root canal treated tooth is not a different tooth. It is as susceptible to decay as your natural tooth. So, we need to maintain good oral hygiene, good care of a tooth. Apart from that, the root canal treated tooth, they become little brittle. So, it is very important, especially in the teeth like molars, which are teeth which we use to chew. So, the dentist put a crown over the tooth, which helps in future fractures. And it restores the oral forces in the oral cavity, and it restores the function of the tooth. So, whenever you get a root canal treatment done, you have to maintain oral hygiene. You need to floss your tooth properly, otherwise there can be decay in the adjacent teeth. You need to brush properly, and you need to get a crown over it.
Does cavity always occur in the molars, the premolars, or the incisors also? Do they also at any point of time, do they also require a root canal treatment?
See, it depends upon the area where there is food lodgement.
Okay.
Why I am saying food lodgement? Because there are millions of microorganisms in the oral cavity. Wherever there is food lodgement, or when you have anatomical morphological variations, for example, if you have, because the genetic factors also play a role, the pits and fissures which are deep, so in those areas there is food lodgement, and when there is a food lodgement there is acid production, because the bacteria, microorganisms acts on this food and produce acid, and this acid will cause demineralization. So, demineralization on occlusal forces during masticatory forces, they forms cavity on the tooth surface. So, it is not that molar is more affected or the incisors are more infected or the premolars. Wherever there is, if the saliva is more in that region, the caries is less. However, wherever there is a food lodgement, there is more, these teeth are more prone to decay.
All right, this brings me to the next question. Dr. Kumar, what precautions can we take to avoid tooth decay, and are there any other options available if somebody wants to avoid a root canal treatment?
Yeah, so what precaution we need to avoid tooth decay is we need to maintain good oral hygiene. There are various factors for decay. First of foremost factor is the diet that we are eating. So, we need to take care of good fibrous diet, avoid eating too many carbohydrates, fermentable carbohydrate, which can lead to decay, and we need to take care of the oral hygiene, so that if the bacteria are present in the oral cavity, they gets a substrate and then they produce acid as described by madam, and they lead to tooth decay. Another important thing is to prevent tooth decay is, everybody says that we brush in the morning, we brush in the night, why we still get decay? The problem is that the important factor is in between meal snacking. So, we are having breakfast, lunch and dinner, and in between that part also, if we are eating 4 to 5 times, then what happens is, whenever we eat something, the pH of our saliva, it comes down and it stays there for almost 30 minutes. So, if we eat something again within that duration, so the pH remains low for longer duration. So, it increases the susceptibility of getting a decay. Right. So, we need to take care that we brush properly, we eat in a measured amount, we eat fibrous food, that is important.
And for how long does a treated tooth last?
So, root canal treated tooth can last as long as your natural teeth last. So, it has a good life, except that you do not have any sensitivity in that particular tooth, but it will function as good as your natural tooth.
All right. Dr. Yadav, when we talk of the medical advancements, the research and development, where is India standing on the global page?
See, the India is a medical hub because it is very cost effective, and because of the use of advanced technology. So, majority of the, there's a medical tourism in India.
Yes.
And the advanced technology which we are using, such as microscopes, the rotary instruments, or magnifications, or you can say imaging techniques like CBCT, they have resulted in a higher success rates and outcomes of root canal treatment.
All right, Dr. Kumar, would you add to it the medical advancements that have been made in this field?
Yeah, so there have been lots of advancement in the field, as Madam discussed. So the rotary night eye rotary files that has been shown in the video earlier, that is one of the biggest advancement. And then there is another advancement, the apex locator. Earlier, when olden times when we used to go for root canal treatment, there used to be multiple X-rays being taken. So that is a lot of radiation exposure to the patient. Now we have electronic apex locator, with which the number of radiation which is exposed to the patient is reduces. Also, it increases the accuracy of the root canal treatment. Plus, there are various advancement in the CBCT imaging, and then now there is a coming up new technique is the robotic endodontics. So, in future also we will see that some robotic arms are doing root canal treatment.
All right. So, for our viewers who've just joined in, today we are discussing root canal treatment, and we have guests with us who have explained us this treatment better, and we will have a quick myth buster round. I will ask you some questions, and I request both of you to give crisp answers. Root canals can cause cancer, Dr. Yadav?
Absolutely no.
You don't need a root canal if the tooth is not hurting, Dr. Kumar?
No, it is not like that. If the tooth is not hurting, but still there is a decay and there is an infection inside, you sometimes requires a root canal treatment.
Once a root canal treatment is done, the tooth is fixed for life. Is it so, Dr. Yadav?
No.
RCT involves removing the root of the tooth, Dr. Kumar?
No, in the root canal treatment, we just remove the nerve tissue and the pulp tissue which is infected. Otherwise, the root of the tooth is preserved.
RCT procedures are always long and draining, Dr. Yadav?
No, it is not draining. It when in case the infection is less, you can go for a single sitting. In case the infection is more, then you can have a week's interval, and it's not at all draining.
A root canal treatment leaves the tooth dead.
No, root canal treatment doesn't leave a tooth dead. It still have a sensation. The patient can feel the pressure, they can bite on it, but only thing is they will not have any sensitivity in the tooth.
All right, so with that, we end this discussion here. Thank you so much, both of you, for joining us on Wellness Watch and helping us understand the root canal treatment better. So, after this wholesome discussion, we did understand that root canal treatment is not the end of your tooth, but it is a fresh start. By saving what nature gave us and restoring its strength, root canal treatment turns pain into relief and damage into durability. In the end, it is not just about preserving a tooth, it is about preserving your smile, isn't it? On that note, we end this discussion here. Thanks for watching Wellness Watch. Bye-bye.